Hello and welcome to Viewpoint on Ukraine Today. My name is Sam Kearley and right now we are joined by Doctor Oleh Antonyshyn from the Canadian-Ukrainian Foundation. Dr. Antonyshyn, thank you very much for joining us.
Thank you for having me.
So, you are normally based in Toronto. You've been in Kiev for the last week or so. Soon you'll be heading back to Canada. Can you tell us what brought you to Kiev? Why are you here?
We're here with a group of medical professionals, all of whom are volunteering their time to work in conjunction with Ukrainian medical professionals to help servicemen that have been injured in the war.
Okay, so how many medical professionals from Canada have come over?
This specific group, there are 22 people altogether, and that'll include 5 surgeons, 3 anesthetists, and a number of nurses. And the nurses are both operating room nurses and clinic and intensive care unit type nurses.
Okay. So what was your objective? When you got on the plane in Toronto, you knew you were coming to Kiev. What did you have set out in your mind that you wanted to achieve while you were here?
Our objective is to bring a totally self-contained unit. So we bring all of the medical professionals and all of the equipment and supplies that would be required to provide sort of comprehensive reconstructive procedures for patients with post-traumatic deformities. We have a pretty good idea of what types of injuries we might see here, and we're fully prepared to treat that full spectrum of those deformities and defects.
Okay, so what kind of injuries are we talking about there?
In current warfare, body armor changes the scope and range of injuries that we might see. Mm-hmm. So those that do survive major blast injuries and gunshots tend to have injuries of the extremities, upper and lower extremity, and of the head and face. For a variety of reasons, mainly for clinical reasons, we decided to focus on reconstruction of defects and deformities of the upper extremity and also of the head and face.
Okay, so these will be gunshot wounds, explosions.
Exactly.
Mm-hmm.
Yeah.
Fairly uncommon injuries, I would expect, in Canada.
Yes, they'd be uncommon injuries in Canada. The institution that we work in, or that I work in, is the Sunnybrook Trauma Centre. It's a major trauma centre in Canada. It's the biggest in Canada. And so we'd see a very large volume of complex craniofacial trauma from around the province. But the etiology of the injuries is entirely different here.
Okay, so we're talking about maybe a car accident in Canada, versus but here it will be a sniper bullet or something along these lines. Yes. So with this in mind, how did you and your colleagues adapt to this situation?
The principles of those reconstructions are exactly the same. And we have the equipment and the technology to allow us to get optimal outcomes in those reconstructions. Okay. So we feel that we're quite prepared to undertake those.
So how many operations are we talking about which you've conducted here on this trip?
We'll complete, in the course of a week, we'll complete about a surgery in about 40 patients. Okay. And we may do double that number of procedures in those patients. So it's not uncommon for us to reconstruct a defect in the skull and then reconstruct an adjacent defect to the nose in that same patient, or a hand injury and a facial injury. So
we're looking at about 40 patients which you've helped.
Right.
And this is not your first time that you've come to Kiev on this project?
Correct. Right after Maidan, the Canadian-Canadian Foundation sponsored a needs assessment. There were 5 physicians that came and went to various parts of Ukraine, and we met with multiple physicians. We held outpatient clinics, and we visited a variety of health facilities to get an idea of what the specific needs were, what the casualties looked like, what the patients required, and what the local facilities were like. And then we chose one particular facility to work in, and we met those physicians and established a collaboration, and we came back, and we've had 4 surgical missions since that time. Okay, and each surgical mission you've been operating on somewhere around about 40 patients? About that, yes. Okay, so it's quite a lot of guys you've been able to help. That's right. But as I understand it, it's not just the operations that you're performing, you're also helping the doctors here in Ukraine learn some new techniques. Would that be right? Yes. We learn from them as well. So the important thing is that it is very much a collaboration. Okay. What we bring to the table is the expertise that we might have in treating trauma, which is very much based on North American standards and techniques, and all the equipment that we have that might be necessary to allow us to complete those techniques. Okay. The Ukrainian surgeons and health professionals and nurses and so on have a vast amount of experience with war casualties. Okay. So they have an excellent understanding of the extent of those injuries and the staging of repair and so on.
So it's very much a two-way street.
It's very much a two-way street.
Okay. So a few moments ago you said that you came over with 20 plus of your colleagues and also a container full of medical equipment.
Right.
What kind of equipment are we talking about?
Well, so we do have disposables, gloves, gowns, and everything. So we want to make sure that we're not taxing the system here in any way. So we have to bring everything that's required to do that surgery and not have it cost the Ukrainian hospital anything. Okay. In addition to that, we bring all of the surgical instruments that we might need to do all of the reconstructions that we plan to do. So all of those reconstructive instruments are left here. Okay. And we also bring all of the implants and power equipment, saws and drills, everything else that's required to do bone surgery in the face and skull.
Okay, so what are these kind of equipments you're talking about, the surgical instruments and the drills and various other things which you need to perform such operations, would there already be similar things in Kiev or in Ukraine in the hospitals?
There may be, to a certain extent. There may not be the number of implants or the variety of implants that would be required. Mm-hmm. The beauty of this is that we can contract out to a company to ensure that they provide sufficient equipment to do this type of surgery for 2 years to come. Mm-hmm. That was one of our major objectives. So we want to make sure that we can outfit this surgical group here to do exactly that sort of surgery with all the equipment that's required for the next couple of years.
So you're leaving enough equipment here for as much as 2 years of the kind of operations which you've been performing in the last week?
Yeah, so we've been very fortunate to be supported by a federal grant through the Department of Foreign Affairs in Canada. Okay. And this has paid for the type of equipment that we thought would be most useful and that the Ukrainian physicians have requested.
Okay. So at this time in Ukraine, there is a lot of reforms happening and also reforms in the medical industry. Mm-hmm. Have you had the opportunity to speak with members of parliament from the medical sector?
No. Myself specifically, we've dealt with the Ministry of Defense mm-hmm. and the medical professionals within the Ministry of Defense, mm-hmm. and not so much with the Ministry of Health. Okay, so have you been able to have some information sharing with the Ministry of Defense of your best practices in Canada and hope to get these implemented on the long term here in Kiev? Yes, we have. So with each and every case, there's a fair amount of discussion, and the energy in these operating rooms is incredible. There are very senior physicians and surgeons who see all of these patients. They're all also medical students and residents and so on, trainees that are in these rooms with us. So with each and every case, we have an opportunity first in the clinic when we see those patients initially to discuss how they might be treated in Ukraine, how they might be treated in North America, what we could realistically do during such a mission. We want to make sure that we do the surgery in as safe a manner as possible. We don't undertake cases that we think would be extremely complex or would have a high risk of complications. Okay. So earlier you said you've helped 40 patients. What's the number of medical professionals who've worked here and helped in a very different way but still equally as important? Yeah, possible to say. I don't know if we keep a tally of them, but I would say we interact with at least 30 or 40 during the course of each week as well. Mm-hmm. Okay. And you're passing on to these your best practices from Canada of how to use this equipment which you brought over? We are. And as part of that program, we're trying to establish, as part of this grant, we're trying to establish a limited number of observerships or traineeships back in Canada as well. So specific individuals will come back to Canada over the course of the next few months to spend some time with us, working with us, doing very similar sorts of surgical procedures, but in a civilian population back home. And then they will spend some months in Toronto, and then they will take that information they've learned then back to Ukraine. That's right. We're hoping that this generates an ongoing relationship that allows us to move forwards, exchanging information and collaborating in the treatment of wounded soldiers. So we are running out of time, so let's talk about this. Let's talk about the future. Do you see yourselves making similar trips in the coming months and years? Yes, we do. Mm-hmm. Whether it's to this specific institution, whether it has the same number of people in each mission is difficult to determine because we have to identify the appropriate funding sources. But we're very much interested in coming back, and I think they're benefited from the experience as well, and they're interested in having us. So there is still much more work to be done? There is, absolutely. Okay. That is all we have time for. Thank you very much for joining us. Great. Thank you. You have been watching Viewpoint on Ukraine Today, where we have been joined by Doctor Oleh Antonyshyn from the Ukrainian-Canadian Foundation. Thank you very much for watching.